guys, so we've had 3 days in a row. This is the 3rd day this week, and this is our lovely guest tonight. This is Dr. Amber Batson, who is going to be talking to us about sleep. Now, what's so exciting about tonight for me is that this is going to be something that everybody can incorporate into their management plan. This has got no price point to it. This is not going to be inaccessible. This is totally accessible. So I'm going to let Dr. Amber introduce herself, and then we'll crack on. So go for it again.
Thanks, Hannah. Thanks to Cam for inviting me. Yeah, I've been in practice for about 21, 22 years as a vet, but very early on, 6 months in my first practice, I started to notice how many dogs, cats were being brought in, and discussion was happening about the behaviour, either because the owner had noticed behavioural change, which is why they thought the animal was sick, something like they were sleeping more, or sleeping less, eating things they shouldn't have eaten, that sort of thing, or just actually asking for behaviour advice. So in the first year of graduating, I started undertaking some behaviour qualifications, which were a little bit dubious back then, if I'm honest, but they kind of got better as time went on, as our science in behaviour got better. And whilst I have worked in clinical practice for all of the last 21, 22 years, I predominantly now do behaviour and welfare orientated education internationally for both vets and non-vet professionals and owners in a variety of countries on all aspects of how behaviour is intrinsically linked really to health and welfare, and what we can do about that. And sleep is something I feel quite passionately about, which is always convenient of an evening to feel passionate about sleep.
No, I love it. I love it. And when I say this is applicable to everybody, I really sincerely mean this. And something that people have heard me say so many times is, when I grew up, we had Labradors, Lancer and Bruno, and they both made old age. But I was from a family that had financial limitations. So insurance wasn't common back then. And there was no way in the world my parents would have been going to, you know, polypharmacy, hydrotherapy, all of these different interventions, intra-articular, never have been on their radar. So one of the things that's close to my heart is making sure that we tackle all of the things that are financially available to people. And this is something that I really want to know more about. So let's start right.
Yeah, sorry. But also, and it's so important. Actually, if you're referred as a human to a chronic pain clinic, one of the things that they will ask you is about sleep. We just had a new study published in Denmark, which has been a huge review of chronic pain clinics in Scandinavia. And they found that assessing sleep and reassessing how to improve the quality of sleep plays one of the biggest parts in pain management of people in chronic pain clinics. So not only is it accessible and affordable, it actually works. That's what's really important about it.
Saying that, I've got a physical trainer at the moment because I've got such pain down my legs and my back because I'm always at the laptop now. It's totally. Now I've been putting it all down to poor posture and sitting position and not being moving. And he did say the other day, he said, "I bet you don't sleep properly, do you?" And I'm like, "No, I don't sleep properly." So yes, maybe I will be taking quite a lot home from this as well. So let's talk about sleep in the normal dog and what we should be offering and expecting for the dogs in our care.
Yeah, so we have a lot of studies have looked at sleep, and historically they used to happen in the laboratory, and they used to take measurements of the dog's brain electricity during sleep, and they used to do that by connecting them up via wires to, in effect, computers. And of course, I'm sure everyone here could appreciate that that's not really conducive to normal, healthy sleep patterns. If any of you have ever seen anyone take part, even on TV, in a sleep study or participated in sleep studies where you go to an abnormal place like a hospital setting and somebody's coming in to take measurements from you and sticking things over your head, clearly it's going to be disruptive to your sleep patterns. So it's only really in the last few years that we've been able to kind of move well beyond those initial laboratory studies and starting to have wireless technology now, which is able to measure the electrical patterns And because we were able to do that, we have better behavioural observation skills of when dogs are sleeping or not sleeping. And so now we've been able to look at free-ranging dogs, what we might call stray or feral dogs to a degree in their sleep, but also, of course, very importantly, pet dogs across lots of different breeds, and do some decent studies about, you know, what seems to be normal for them. I still don't think we're quite there yet. We've just had some new research published about wireless technology, being able to use that in a computerized way to kind of look better at pet dog sleep. So I think in the next year or two, we're going to get a much better kind of set of parameters, really. But where we are now is the average adult dog probably needs somewhere between 10.5 and maybe 12, perhaps a bit more hours of sleep across 24 hours. You know, whereas obviously we know for us the kind of average is between 7 and 9 hours in 24. That's what
I feel bad now. I'm one of those irritating owners, in that I haven't got children, so, and I haven't even got a husband or a boyfriend, so Luna is everything, you know, and she does sleep in the bed with me. And because I'm a bit of a night owl and an early riser, she actually will, at the age of 2, kind of come and start looking at me going, can we go to bed now? I've had, and she's almost like, we're going to go to bed now. And she sleeps through. She sleeps really well. Yeah. So that's quite interesting. 12 hours. What kind of can they have it in morsel fashion, or does it have to be chunks?
No. Yeah, so they are what we call polyphasic sleepers, whereas we are monophasic sleepers. So they need to take it in patches across 24 hours. They do have a rhythm. Well, some dogs have a rhythm across 24 hours like we do, what's called a circadian rhythm, where we kind of, even if you were kept in the dark for weeks and weeks, your body would still have some vague idea of what a 24-hour period was like. Interestingly, studies of dogs have shown that dogs can keep a circadian rhythm, or they can drop a circadian rhythm. And mostly it's to do with the fact they have evolved to take their sleep where they can in patches. So they do seem, when they live alongside us, the evidence is that they tend to take the majority of their sleep at night. So they will take maybe a 6-7 hour period, maybe a bit longer, in the middle of the night. But if they don't live so closely alongside humans, so more free-ranging dogs, actually they can be pretty active at night and sleep a lot more in the day. So dogs that have this adaptability, which is just as well when we think about the kind of different circumstances we expect pet dogs to live in. Some of us might be work night shift, some of us then change to day shift. Some of us have got noisy children and babies that wake up all the time. Some of us haven't, you know, and it's kind of tricky for them. It's probably not so tricky for them to kind of get used to being able to take sleep at different times in the day. It's being able to fulfill the other criteria. That's the big issue, you know. So as an example, one of the other biggest criteria, which is something which has really been highlighted by 2 studies in the last year, is that dogs are social sleepers. Right. You know, dogs are a highly social animal anyway, but we had Rachel Kinsman published some work last year, which was owner collected. So it was a questionnaire based thing, dog owners looking at the sleep patterns their dogs were offering. So no offense to any owners, because I'm one, you're one, most of us are one. We're not always the best at observing our own dogs. And you know, do we know when they are resting compared to when they're sleeping? You know, some dogs might look like they're sleeping, but maybe they're not. And then equally, maybe because we were asleep, we didn't notice that the dog was asleep or not asleep for several hours. So owner-based questionnaires are always going to be a little bit kind of, how good is that as evidence? But, you know, one of the things that really came out of the study, which they've tried to highlight, was when dogs had the opportunity to sleep near a familiar individual, normally a human kind of partner, human caregiver, 86% of them wanted to do so. So that really shows us how important social sleeping is. And then we've got some other research.
And when you say social sleeping, you mean in the same vicinity?
Yes, in proximity. I mean, some dogs want, literally, as we all know, to sleep on us, you know, or touching us. But for some dogs, it's just a proximity thing. And we've had some other research since then as well. Corticus also showed the same thing. They looked at wolves and domestic dogs, and they found that the domestic dogs in particular really, they got the best sleep when they were in social contact. When they weren't in social contact, they would sleep, and you can't not sleep. This is a really horrible thing to say, but to highlight, but back in the 18 something, there was a lady in Austria, and a doctor who actually did sleep deprivation studies on puppies, and they wouldn't let them sleep. And it's quite interesting what she found, but basically by not letting them get any sleep, they all died within day 5 or day 6. And
oh my God.
Yeah, and unfortunately similar studies have been done on adult dogs as well, and with adult dogs it takes about 10 to 12 days before they die. But that just shows us we never have to replicate that awful stuff again, but it shows us how crucial sleep is. We often don't think of sleep as a behaviour because we think nothing's happening, but actually it is one of the most important things we do every day as a mammal anyway, that allows us to stay alive. If we don't do it properly, we get sick, and so one of the problems is that we might be able to get enough sleep to survive, but then there's a big difference between survival and thriving. So getting appropriate species related patterns, so getting at least 10 or 11 hours across 24 if we're a dog, and the depth of the sleep, being able to actually go into the right brain electrical patterns for long enough. So we were talking about dogs being polyphasic sleepers. They typically, will take 2, 3, 4 patches of sleep throughout the daytime, and then perhaps 1, maybe 2 longer periods more in the nighttime. But typically their full sleep cycle, as we call it, from kind of being drowsy to going to sleep to going into different electrical brain patterns and then coming back through that brain electricity, takes about 1 hour and 20 minutes for a dog.
All right. Yeah. So they're not like us with the whole cat napping thing, because I used to work in the summer with farmers who used to just, during the harvest, they'd cat nap for like 20 minutes and feel that was just to kind of top them up. They're not like that. We're not talking short, tiny blocks. Well,
they can do, but it's not good enough. I mean, that would be the same for the farmers too. The farmers is probably going to get sick as well. But they can, and in a way they're probably more adapted to it than us, because they're set up to take it in these patches compared to us taking it as a block. But in order to fulfill a proper sleep cycle, they do need about 1 hour and 20 minutes. But what will happen is then they're awake. We tend to link our cycles together. So our cycles are shorter, but what we do is we go through our cycle and then we move straight into the next cycle. So we will have 5, 6, 7 cycles of sleep over a night time, whereas a dog will have 1 cycle and then they're awake. And then they'll normally get up, they'll move around. If they're able to, they might go outside, go to the toilet, they might make some food seeking opportunities, check in about social contact, and maybe within half an hour, they might take another patch of sleep. They can, link these patches together, but not as well as us. So there've been some studies looking at the impact of pet dogs sleeping on human sleep. And they all tell us that it's not a good idea for dogs to sleep with us if you want good quality sleep. Because I have an English Bull Terrier, and we have a few dogs, but he is an individual who gets cold really easily. They've got thin hair coat, they don't have much body fat, he's all muscle, and so they get cold. Bull Terriers get cold easily. So he's under the duvet, warm up, probably maybe he can make it for half an hour, maybe over an hour, and then he's too hot and he gets out, and then he cools off, and then he goes under, and then and it's that constant thing, which is normal for them, but it's not normal for us, because once we're awake, we can't go back into it. It's harder for us to get back into that kind of type of sleep pattern. So social sleeping is a big thing for dogs, and so that it just kind of tells us how important 24/7 social contact is, because although they take a good amount of sleep at night, they still need 40% of their sleep in the daytime. So if we've got kids running around the house, if we're up and down, if we've left them by themselves, then the likelihood of them getting good quality sleep in the daytime is significantly reduced. And when we think about pain, or other elements of what happens when we don't get enough sleep, then it can not be a surprise that dogs are struggling emotionally, behaviourally, from a pain perspective, because they're not getting enough sleep perhaps in the day, even when we think that we're meeting their pain needs at night.
Yeah. So just to finish the healthy dog before we dive into the pain.
Yeah.
Are there any breed differences that we need to know about? Because we've got a massive spectrum of breeds out there.
Yeah.
Are there differences between, or is this a generalist applicable to all?
No, it's a generalist thing. A dog is a dog. Certainly from their core kind of keep my body and brain in balance behaviours, then they're a dog. The only real breed differences that we do see is that breeds like the brachycephalic dogs, our short-faced dogs, we know that they are more prone to having things like sleep apnea, where because the palate is long it hangs into the airway in some of them, that actually it stops them breathing properly. And so we had a new paper, literally, I think it's hit the press now. A really nice guy called Mondino and his colleagues have published a brand new paper looking at the pet dog and disorders that actually affect quality sleep patterns. And sleep apnea, where you basically are going into a period without getting enough oxygen into the body because you're so relaxed, your palate softens and goes into your airway, it wakes you up. And it doesn't necessarily mean that you feel like you're choking, but because you couldn't get enough oxygen in, your brain went, you need to wake up and take deeper breaths. And so sleep apnea, as an example, is a very common cause of sleep deprivation in the brachycephalic dogs. And we might get it in other breeds too. We might get, perhaps when they're obese, certain breeds have tendencies. Yeah, that can have an impact.
With hypothyroidism and laryngeal paralysis and things like that.
Exactly.
So Laura's made
a
question, does the sleep change with age as well?
Yeah, so very good question. Just like us, of course it does. When you're a baby, human baby, you're sleeping a lot of the time. When you are a human puppy, I was about to say then, that's not right, is it? When you're a puppy, you do sleep for much, much longer. Puppies can need as much as 22 hours sleep in the first few weeks of birth. And then kind of over the first 8 to 10 weeks, it gradually kind of gets closer to adult kind of amounts, but not quite. Probably by the time they're around 16 weeks old, that's what Rachel Kinsman's was looking at, that's about the point where they seem to be on this sort of around about 10 and a half, 11 hours sleep, in 24 hours. That's owner observed, so it might be a bit more. We need a little bit more data on that, but that's kind of a constant then throughout your life as an adolescent. As far as we know, that's what Rachel looked at. She compared 16-week-old puppies with 1-year-old adult dogs, and there was a slight difference in the amount of sleep, but we're talking half an hour, across 24 hours. It's not significant enough for our practical purposes. But when they get older, then what happens is that you get there are 2 types of sleep. I think most of us know that. We have something called slow wave sleep, and then we have something called rapid eye movement sleep. Rapid eye movement sleep is what we often call dream sleep. It's when we experience dreaming. It's when we see ourselves, our partners, or other people twitch. We might see the eyes move around under the eyelids, and the breathing rate is different. So when you're in rapid eye movement sleep, you breathe quite shallow, you breathe quite quickly, whereas when you're in slow wave sleep, sometimes it almost looks like you've stopped breathing at all. You have these real deep, slow breaths, and there's no real movement there at all in the body. So they're very, very different electrical patterns. Slow wave sleep is what it says on the tin. It's very, very slow waves of electricity all across the brain. Whereas rapid eye movement sleep, there is more brain electricity activity than there is in you and me right now. And that's not a joke, because it's 7:30 in the evening. We have a faster amount of brain electricity when we're in rapid eye movement sleep than we do when we're awake. It's called theta activity. So really different patterns of electricity and very, very different purposes, as it were, benefits to the body and brain of those 2 types of sleep. In dogs, they need about 25%, 30% of their total sleep as rapid eye movement sleep. So kind of 65, 70% of their sleep is slow wave. But as they get old, as they become senior geriatric, then we see a decrease in the amount of REM sleep. It can go perhaps down to 15, 20%. And we see an increase in slow wave sleep. And I think a lot of us recognise that in our older dogs, because we notice that they perhaps become harder to disturb. You can step over an old dog sleeping and they don't wake up. And perhaps we think it's because the dog's going deaf. There's changes in their sensory perception. And sometimes it can be, but it's actually just because they're in these deep, slow wave sleep periods for much longer. And that's important for them that we meet that need. However, they actually overall take less total sleep, both slow wave and REM sleep, at night. And again, I think a lot of owners know that because they're woken up more frequently by older dogs. There's a tendency for us to sometimes think that that's medical in some way, that maybe they don't have such good bladder control, maybe they've got some kidney dysfunction, so they're drinking and needing to urinate more, maybe they've got cognitive dysfunction, that sort of dementia thing that old dogs can get. And definitely dementia in dogs worsens this because they typically have even worse nighttime sleeping patterns, but it's just an old age thing. And old people get it too, even without dementia, that they start to sleep kind of less at night or less deeply at nighttime. So realistically, total amounts, they don't make huge differences once you've become perhaps 4 or 5 months old. But there are some changes as you get older that perhaps you change your sleep pattern amounts and you sleep less at night.
Amazing. Okay, that's good to know. Okay, so now let's step into, could we just touch a little bit more about juvenile to adult dogs not having sleep? Because one of the things we said before we went live is there's many people that are watching this live that are watching it about their dog that is in pain, but they've also probably got other dogs in the household as well.
Yeah.
Has there been studies that are looking at sleep linking to behaviour or other physical deleterious changes not related to pain? Just briefly before we jump into.
Yeah, or probably one of the kind of best studies that's looked at that, and which is really new, 2020, was a study by Bollo and colleagues, and that's actually found that dogs not getting enough sleep results in dogs experiencing negative stimuli, negative things, in a more negative, from a more negative perspective. So in effect, they become more threatened, more fearful, more reactive to things that might be negative. So it has a real sleep deprivation or sleep reduction, which is often a better term. We tend to use sleep deprivation when we're getting no sleep. It's obviously when we're just not getting quite enough for our species, we call that sleep reduction. So when dogs are sleep reduced, then they become more reactive. They become more emotionally responsive. And so, of course, that might impact on them barking at another dog on the street, might impact on them being more irritable to the groomer or to the owner, or being aggressive at the vets, all that kind of stuff. We know that if you don't get
related to yourself, can't you? Like as vets, we often have done and we've done on calls, and I know that if I've done a night shift or I've had a disturbed night, you almost have like a presence in your head. You feel a bit sick, you feel heady, you don't feel that you can think quick enough, and you're just gripey.
Yeah, exactly. Well, exactly. And one of the other things, which I think most of us know, is that if you're not sleeping very well, and that can just even be after one night's sleep, like you said, you lose your focus, you lose your ability to concentrate, and that's a very well recognized thing. And in part, it's to do with activity in a part of the brain called the hippocampus. The hippocampus is the memory-making center, of the brain, although it's very much involved in emotions. And hippocampal function is significantly affected by sleep reductions. So we've got some research on this specifically in dogs, showing that dogs that don't get enough sleep can't make memories as effectively. So if you want them to be able to remember well, if we want them to learn well, if we're trying to retrain them or train them as puppies or adolescents, making sure they get adequate sleep is really important, just like it would be for us, So, and then I suppose the other thing which is quite relevant, which again we all know, is if you've been out partying. Who does that these days? But remember those days when we used to go out and party?
We used to do that.
it's a long time ago since I've been out and partying, I'll tell you. But we've all done things like, whether it's been on call for work, or we've just had a rotten night's sleep for whatever reason, or we've been partying. We might put the partying thing down to certain additions that we might use during partying, that they may have affected our appetite. But actually, it's the sleep deprivation. So sleep deprivation has been consistently shown to affect the way we stabilise our blood sugars. So if you don't get enough sleep for your species, you get hungrier. So that kebab that you feel that you need the next day, or that goes.
That's when I go into a carb monster.
Exactly.
I did a night shift. This is a dirty secret. I did a night shift once, and at 9:30 in the morning, I got myself some cheesy chips.
Yeah, exactly.
Yeah,
I doubt that's I think that's probably an acceptable secret for most people. Most people have been in that state, haven't they? Where they know that they've just craved food the next day after they've not had enough sleep. And they say sometimes we put that down to alcohol, and alcohol does have effects. The hangover effect. That is true, but actually it's because, and we might talk about this a bit more later, but alcohol stops you sleeping properly. You might think you passed out, you might think you were asleep for 8 to 10 hours.
So too. Yeah.
But it's not, because you didn't achieve good sleep patterns when you had that drug in your bloodstream. Drugs have been shown to significantly influence our actual sleep quality and the sleep patterns. And so because you didn't get proper sleep, you're really hungry the next day. So again, we think about adolescent dogs who actually, because of their growth rates, because of their hormonal changes, all of these things are, you remember when we were teenagers, I'm sure most of us can remember, you could get away with eating anything and you needed to eat a lot. And that's worse if you're male, actually, but if you're female, it still applies. And as a result, you're hungry all the time. Well, now imagine you're really not getting enough sleep, and that's making you even hungrier. It's no surprise that dogs start scavenging. They start eating things that they shouldn't be eating, what we call pica, that eating of abnormal things, cushions, toys, coffee cartridges, and the kind of, in clinical practice, we deal with pica a lot, don't we? We have to retrieve foreign bodies from the guts of dogs a lot. And sometimes it's an accident. Maybe a dog swallows, a wrapper because it was part of the food. Maybe they've eaten the whole chicken carcass and it had the plastic and polystyrene attached to it, and that's an accident. But some dogs are going out actively to just eat, frankly, anything. And that can, in part, be influenced by not getting adequate sleep, because not getting adequate sleep makes you hungry, so hungry. And of course, this is a species who we control have access to food. So they can't just pop to the local shop and get some cheesy chips. They've got to actually wait for us to give us food. So they don't. They just go out and find something else to swallow. So it's something else to consider. If we don't want dogs to feel overly hungry.
It's going to be interesting if a load of cam followers go and see their vets, because this is all new to me as well. So I'm not saying that all vets should know this. This is quite off the syllabus, really, for a lot of vets. Just be careful if you go to your vets this week and say, right, well, I know he ate that tennis because he didn't get enough sleep, because they'll think you're barking bad. You heard it here first. Okay, so now let's step into pain and the negative situation where you have pain causes poor sleep. If you have poor sleep, pain is worse. So explain that for people.
Yeah, well, so that has received a lot of attention in the last 10 years as well. I mean, and initially the belief was that because we were in pain, that actually that's going to reduce your sleep. And that's obvious, isn't it? We know that ourselves. If you can't get comfortable because you've got a dental abscess or an ear infection, or perhaps you've got a really painful injured knee, you can't get comfortable. And so as a result, you get less sleep. But interestingly, in the last 7 or 8 years, what the studies have really demonstrated is it's actually more driven the other way around, that a decreased amount of sleep for other reasons increases our pain perception. So, actually, although it might be one night, if you've got a bad dental abscess and it's just come on, and you've not taken any pain relief or whatever treatment for it, it may well be that you sleep really poorly that one night because of pain. But that one night's poor sleep, then the following day drives a huge increase in pain sensitivity. So we've got studies that tell us that just one 24-hour period with not getting enough sleep significantly increases the pain experience for that individual the next day.
And you can totally relate to that too as well. I can feel how that can happen just from my own experiences with myself. Yeah.
Exactly. And so I said earlier, there's all these silent things that happen when we're sleeping, and there's too many of them to talk about now, so we just have to summarize it really. And that in essence, I mean, obviously we know that, well, many of us probably know, but we pick up pain both in our skin and our muscles and inside our body, obviously in our gut, in our liver, in our heart. We can actually feel pain all over our body, pretty much all over our body, through these special receptors that detect potential tissue damage. So it can be damage from too much heat or being too cold, or it can be through kind of mechanical damage, so being crushed or squashed or whatever. And so those signals, those receptors picking up that potential damage, send a message up to the brain. And a lack of sleep or reduction in sleep actually seems to make those receptors more sensitive. They're more likely to pick up damage. And then we also understand that there's always this feedback from the brain down to those kind of receiving points, those receptors, which is what we call a descending, because it's coming down from the brain, a descending inhibitory circuit. It's basically trying to always just quieten them down. And what we know is that sleep reductions switch off that descending inhibition. Double negative means that they're switched on more, basically.
That's bad.
So that's kind of our main part of it, with also perhaps the exception about stress, as well, and what happens in the stress pathway. So typically when we're sleeping, it's all pretty complicated, but trying to kind of make it as simplistic as perhaps isn't appropriate but works, is that when we don't get enough sleep, our stress levels go up, and again, we've got some newer research in dogs in that vein as well. So that, when we disrupt an animal's sleep, that's a stressor in its own right, the fact they can't get enough sleep. And whether we do that or that's done by pain, it's going to happen in both ways. Not getting enough sleep is going to add to the stress. And then we know that these stress chemicals, certainly the chronic stress chemicals, so cortisol, they switch on our pain circuitry. And that's a well-recognized thing. They do the same thing. They increase our sensitivity of those receptors. From a simple point of view, it really is going back to the evolutionary purpose of kind of chronic pain. I talk a lot nowadays about this awful event that happened last year, pre-pandemic, for most of us. We were aware that Australia were having severe fires. And if we think about a koala who was up a tree when they detected the fires coming, they would have scampered down their tree. They've detected the smoke, they've detected the heat, they can hear the noise, and they're trying to run away. And, within several seconds to minutes of detecting that stuff, they're going to have moved into what we call the chronic stress pathway, because the chronic stress pathway producing cortisol is all about being able to keep you moving for as long as possible. That's what chronic stress is for. Nowadays, we talk about the fact, I'm so chronically stressed because of the pandemic or because I can't pay my mortgage or whatever it is. And that's true and it's totally valid. But the chronic stress pathway is actually activated within minutes of an ongoing stressor. So that, koala who's come down from the tree, who's trying to run away, he's in a chronic stress pathway. And so it's really important for him in that situation that he detects any possible pain. That he increases his receptors, because his body needs to know, am I getting too close to that fire? What else is going on in my body? Now, it's a little bit offset by acute stress. That complicates things, because acute stress, that kind of split second in the moment stress with adrenaline and noradrenaline, that dampens down our pain response, doesn't it? When you're just trying to run away from something quickly.
That's
but
the
when
soldier
it's got to be
or who's
sustained,
injured still keeps going, that type of thing. Yeah.
Yes, exactly. But it doesn't last that long. Your chronic stress pathway starts to take over. Now, of course, the koala's in a mixture of acute stress and chronic stress. For many of us, or for some of our dogs, particularly those who are sleep deprived, they're only in a chronic stress pathway. So when you're only in a chronic stress pathway, you don't get any of that benefit of dampening down the pain response. You only get the negative of switching on the pain response. And so because sleep deprivation increases chronic stress, or is a stressor in its own right, a chronic stressor, then we kind of, we get more sensitive to pain, and cortisol also stops something called serotonin working very well. And serotonin is our main kind of pleasure, feel happy chemical in our body and brain. And so because cortisol stops that working so well, then we're also equally become more sensitive to not feeling so good. We feel a bit more negative. And there's a real emotional component to pain. I'm sure anyone who's followed CAM will have heard about this before. It's not just the sensory element, it's how your brain interprets that sensation. Does it make me feel sad? Does it make me feel frustrated? Does it make me feel angry? We've all had that when we've had intense or ongoing pain. And so serotonin is normally a very good chemical to help us deal with that. So actually, if we're in a chronic stress state, or if we're in a sleep deprived or reduced state for a period of time, we lose a lot of that benefit. And so we slip into negative emotions easier. So, the whole pain thing within a day or two just starts to get a lot worse.
Yeah.
So we have to think, what are we going to do about it, don't we?
Yeah, a different thing that I need to have answered, and this is a genuine request. So I've had a couple of cases now where people have obviously allowed their dog to sleep as much as they like, but then the dog is therefore very stiff and doesn't actually want to move. And there's always trying to find that balance of getting them up to move around, to lubricate the joints, to get the muscles, ligaments moving, to distract the brain, to engage in pleasurable activities, which we also know will have a positive impact on pain, but
absolutely
allowing them to sleep. So I think the fact that you've said, hey guys, let's go for, what do you say, between 10 and 12 hours, or 11 and 12 hours?
Yeah, I'd say about 12, probably, until we know better.
About 12. So that's a kind of guidance, guys. But I have definitely had that difficulty where an owner's allowed their dog to lay in, and then the dog never has that get up and start moving, and it's quite, I can't be bothered, it's too painful. So there is a balance there. Don't all of you go and just go, here's your bird, lay there.
No, you're absolutely right. The thing about the brain and about behaviors and things that balance our bodies and brains is about balance. You can absolutely have too little of something, and you can absolutely have too much. If I hear that a dog is sleeping for 16 to 18 hours a day, that's not right. That dog is out of balance. Now, they probably are not sleeping for 16 to 18 hours a day. If we were to look at the brain electrical patterns, what they are probably doing is withdrawing. They're probably resting, or what we would call, they have become inactive. It doesn't mean to say they're actually in a sleep pattern, and that's quite different. So absolutely, to a degree, if you've got that level of immobility, is not what the canine body is set up for. So they are going to get obese, they are going to get stiff, they're going to kind of squash their muscle groups and make themselves sore. They're going to get maybe too cold because they're not moving around enough. All of these sort of negative, like you say, they're not going to get enough of the positive things that they might enjoy, that might make them feel better about their pain. So once you understand sleep patterns, it kind of hopefully gives you a practical thing to consider, which is actually a dog would normally be most active at dawn and dusk, certainly in the morning, certainly later in the afternoon. And, so if you're seeing a dog who actually doesn't want to participate in being active at that time of day when they used to, then we'd start to think, is their pain too much for them, or is there another cause for that inactivity?
So interesting. Like Holly, throughout her life, even towards right at the end, 10 o'clock nighttime crazy time, between 9 and 10, she just came alive. And I was like, you're not supposed to be very well, love. She was up and mischievous and into things. And I mean, oh my God. But yeah, we noticed that.
I mean, don't get me, obviously dogs can have individual differences. And we've had a few studies that have looked at personality differences within and between breeds. And we're talking like 13 to 15,000 dogs in each of those studies. So quite big studies. And they've both shown how there is more personality difference within a breed than between breeds. Okay, right. So it's not appropriate to really say, oh, let's look at, and I'm going to say the English Bull Terrier because I live with one, but the English Bull Terrier, you know, everyone says, oh, they're quite lazy dogs. And I have to admit, ever since we've had our English Bull Terrier, we've had him since, a 10-week-old puppy, he's been lazy. He doesn't like to get up in the morning. He is a duvet day dog. He really genuinely would stay in bed until probably about midday, and then he's active then from midday until probably 8 o'clock at night, and that's his activity time, really. But that doesn't mean to say all English Bull Terriers are like that, and and not all Labradors are something different, and not all Whippets.
Which fits totally in with our attitude towards pain, and we always say, and many lives it's repeated, the dog is an individual. And that applies to how they're going to clinically present, what their actual underlying pathology is, and how they're going to respond to your management plan. So just because Mabel by the poo bin has got her dog on this, and this, doesn't mean it's going to be the same for your dog. And that's where being observant and objective is really, really important. And I'm going to do a terrible plug now. That is in the owner course that is now released.
Well, in fact, I was going to plug it for you, to be honest. You've got some stuff. I was going to say, you've got stuff about that. You've got useful resources on your website. I recommend them to people who study with me as professionals and people with owners all the time to keep a diary of those observations and then consider them how they compare to how the dog used to be. Because I think it's those comparisons, that, if my English Bull Terrier now started sleeping until 5 o'clock in the afternoon, or if he started waking up frequently at 4, 5, 6 o'clock in the morning, I know that's really abnormal for him as an individual, and that's what's really important for us. Although we do know that whilst dogs have a range of sleep that's maybe between perhaps 10 hours and maybe up to 14, 15 hours, by the time your dog's an adult, you'll know where your dog is. My English Bull Terrier is definitely closer to the 15 hours. There's no doubt about it. But I've had plenty of dogs in my life who perhaps were closer to the 10-hour mark, But if I'm seeing a dog who's sleeping a lot less than 10 or 11 hours, or a dog who's sleeping a lot more than 12, 14 hours, then that's wrong regardless. There's something really wrong with that. And they probably aren't sleeping. They're probably withdrawing, being inactive. And of course, the most common cause of that, there is no doubt, is pain.
See, this is now why, and I don't plug products often or enough, to be fair. But and I don't know why I get drawn to some products. And there's practicality. But Luna wears a pit pat, and I very much got interested in pit pat because of looking at their activity. But now you've told me how powerful looking at how much sleep she's doing, which is, they can't measure, as you say, the brain.
No, exactly.
You can actually say the dog was sedentary for this period of time. That's quite interesting. Another use for the pit pats, which I quite like. Okay, so can we talk a little bit about exercise and sleep, and then we're going to talk about medication. So let's do exercise. I'm already really conscious. We've already hit 3/4 of an hour.
We'll wrap it up a bit. I think they're shorter topics to a degree anyway, though, I think. Actually, I'm going to wheel you back. Do you mind? Before we talk about exercise, what I'd like to talk about is making sure that the painful dog is able to get enough sleep. Go back to the practicalities just for a minute, because we talked earlier about social sleeping as an example, that the majority of dogs prefer social sleeping, and they get the best quality and amounts of sleep when they socially sleep. And many people like yourself, you know, are willing to let their dog sleep in their room or sleep on their bed. And of course, when we get the very arthritic dog who perhaps now can't come upstairs anymore, you know, that might be a real considerable change for them as an individual. And one of the things that we do need to put some thought into is, if that's going to be a change, if we're going to say coming upstairs is no longer an option for you, then we've got to think about how that's going to impact on their sleep. Because if their sleep quality reduces as a result, then their pain is going to go up. I have no doubt about that. So what are we going to do? Are we going to take a bed downstairs and sleep next to our dog? Some people do. Do we think about providing perhaps some of our smell? You know, maybe the pajamas we wore last night is what the dog can sleep on today. You know, maybe do we...
Did you make a den at that time? Because I know a lot of dogs actually quite like an enclosed space, as you said.
Oh, now you've touched a nerve.
No. Oh, no, tell me.
Well, it's a really interesting thing. And in all the free-ranging studies that have been available, dogs don't den for sleeping. Dogs prefer to sleep in open spaces with other dogs. And so we've a lot of us have heard this myth that dogs like dens. And it's not that dogs don't use kind of enclosed spaces to maybe escape from something scary. You know, if they're scared of something, dogs will like to hide underneath something. There's no doubt about it. But it's not where they get good quality sleep patterns. In fact, if we look at dogs who are able to make choices, so domestic dogs, but who are able to make their free choices, they typically sleep on something that's slightly elevated in an open area.
Who's this?
Don't ask Amber about
It's like, Hannah, don't say den.
Yeah, well, and it's just a really interesting fact, isn't it? And I think sometimes, as I say, it's a huge topic in its own right. Our crates are actually great.
Talk about it.
You know, and that's
about it, talking about things that have got maybe a lot of myth behind them.
Yeah, well, exactly. And so again, we've got to go back to, what does this particular dog do? And I think the word that we have to keep coming back to is choice. Are we offering the dogs choice? Because dogs prefer social sleeping. So have they got that choice? They prefer to be able to move freely. Every one of those sleep patterns, we said, they get up, they move around. And when they get up, move around, they go, and they literally will walk around the room, or they'll move from room to room, because they're looking for opportunities, they're checking everything out, and they'll do that before they go back into a sleep pattern. If they're confined in some way, they can't do that. They like comfort, you know, and they prefer to intermittently, not all the time, use elevation. That's why dogs love to sleep on our sofas and on our beds. So that was going to be one of my other things about when they become painful, is how practical is that for them? You know, are they still able to get safely on and off the sofa, or safely on and off the bed? You know, and sometimes it's just as simple as us putting in a step or two, isn't it? Or maybe in some owners' homes, let me
tell you about Fletcher, because this is a good story. Fletcher was a 38-kilo German Shepherd, a pretty big boy, and he had his sofa. It was his sofa. You know, the ones that are like collapsed in the middle, and they've had them for 10 years. Stinks of dog. Yeah. And he was really struggling.
That is our sofa at home. That's our sofa. But yes,
is that your sofa? And he was really struggling to get on and off. And if we were to put anything in front of it, that was a no-go. That was strange. No way. So what we ended up having to do was we made a box, a really firm, solid box, the length of the sofa, and then we got a huge throw that went across the whole sofa over the box. And he was like, well, this is my throw. This is fine. I can use this. He was fine getting on and off. But I will admit, when I first started being interested in arthritis, I made the mistake that I think a lot of people do, which is modifying their environment with a really protective mindset of, must wrap them in cotton wool, they mustn't do this, they mustn't do that. And then I realized that actually I was leaving them frustrated, anxious, because they couldn't do their normal. But that's because I'm not a behaviourist. I was thinking very occupational therapist. But now I realize actually you have to try and help them stick to their routines.
There's a balance to be found in, isn't it? We do need to protect them. It's just like the stairs thing, you know. I mean, but there are ways of going up the stairs and there are ways of going up the stairs. And it depends on where the dog's problem is. You know, if they've got elbow arthritis and it's really quite bad, then coming down those stairs is absolutely the worst thing they might be able to do, particularly if they're a dog who comes down quite quickly.
Yes. I've had no lie. These are in the lectures that I give. I have had 2 owners put lifts in their houses. They have apple cored out the centre of their home to put a full-blown lift so the dog can go upstairs. Another owner sent me a video clip. They've got a Stena chairlift, ripped off the chair, put a platform in. And the reason they sent me the video clip is because sadly the dog had passed and they wanted somebody else to benefit. So they wanted to give it away to another family. Unbelievable what people do with dogs. It's beautiful. Okay, so we talked about bedding. So choice. So when you talk about choice, we're looking at also type of bedding, position of bedding, you know, the environment that the bedding's in, all of these things, choice.
Yeah. So going back to the den thing, just about the choice, you know, about the choice of the situation, is that there, depending on, I mean, you know, there are dens and dens. I mean, dogs do prefer social contact. If I haven't said that enough, I think I've said it enough. But they do also like things, you know, they're going to have to go into sleep patterns on a regular basis across 24 hours, which includes in the day. It can't be that noisy or that disruptive. You know, if you've got kids running out, if you've got other younger dogs bouncing around, blah, blah, blah. So it kind of makes sense that sometimes if we think the occupational therapy way, that we do need to protect them a bit and we do need to provide kind of some sort of barrier which allows them to understand they're not going to get knocked into by the younger dogs, or they're not going to get knocked into by the kids. So it's not that some sort of protected space, some quieter, calmer space isn't an appropriate thing. You know, and if that is a large crate with an open door for some of your pets, then that's great. But let's make sure it is their choice, and let's make sure that it at least gives them the ability to lie flat out, stretch out fully, because they need to do that for REM sleep, and that there are some options in terms of comfort and temperature control. You know yourself, if you're too hot, you can't sleep properly, and if you're too cold, you can't sleep properly. And chronic sleep deprivation makes you cold. One of the things that the crazy lady in Austria, when she did the sleep deprivation studies with the puppies, discovered was that their internal core temperature dropped dramatically by day 2 of sleep deprivation. You know, so there's a real link between hypothermia and sleep deprivation. Now, obviously, if it's just a bit of sleep reduction, it might not have that big an impact, but most of us tend to feel colder when we're not getting enough sleep. And of course, if we're less active, because we're an arthritic animal as well, we're not moving like we used to. And maybe if, obviously, not all arthritic dogs are old, clearly not. You know, this, for me, a lot of this started, I took on a Labrador puppy when I graduated. He came to my graduation, and, you know, by the time he was only 12 weeks old, he was diagnosed with, in effect, generalized osteochondrosis dissecans, which is a horrible disease of the cartilage. And it left this poor dog with arthritis throughout his body by the time he was 9 to 12 months of age. So, you know, I learned very early on in my career about how, you know, arthritis-related pain isn't just for old dogs. It can come in for young dogs too. But obviously, as you do get older, your heart and lung system changes as well, and you're more prone to perhaps having lower blood pressure or some sort of kind of movement-related and blood flow-related issues.
Yeah.
So you'll get
just
older
to step in with the occupational therapist hat on again. Just because we've said that they're more likely to be cold, please don't start doing things like loading the coats up.
Yeah, absolutely.
I see that quite a lot. And the other one that I see that is, now I say, it'll be like, oh, that's so obvious, is when people tuck their dog in. And lots of people do it with the best intention. It's like a child, I'm going to tuck you in. And the dog then moves around in the night, and that blanket turns into a little spiral around that foot and becomes trip hazard. And you can just watch these weak, fragile legs that haven't got strong stability, and the foot, we don't want that. So be really, really careful about keeping your dog.
And that's why it does go back to choice, doesn't it? Because actually, have they got a bed near a radiator that's on? where they can choose to get closer to get warmer, or perhaps have they got a bed with a heat mat or something and a bed without one. And so they can move between the two. And if we are going to provide them with some sort of cover, I mean, my English Bull Terrier, even in the middle of the summer, won't sleep unless he's under a blanket. But I would always give him firmer things like thin duvets, which he can move over himself or he can get underneath. So that deliberately that he doesn't then get trapped and he's able to move out from underneath that. And when we have arthritic dogs or limited movement dogs, absolutely we've got to make sure that things are comfortable, but they need to be quite a smooth, level surface so they don't get caught up and get wrapped in it. Which is why these orthopedic mattresses and all those sorts of things are often better as a base, aren't they?
Yes.
Because they provide some sort of kind of give, but with some resistance, which at the same time they're not going to get caught up in.
And they're predictable. And sadly, the truth is, if you're somebody that's very aesthetic, you know, that's appealing to you, you're not going to like the beds that we like. So these aren't fluffy. They don't come with diamantes. There's no feathers on them. They're pretty dull, but they're predictable. They've got a defined edge. They know how deep the bed is going to be, so they can step onto it. It's got a reasonable amount of security on foot placement. So just be aware that boring doesn't mean bad. And that just finishing about the blankets, don't get caught into the petrol station kind of like gimmick thing. You know, when you go and fill up with petrol and they're like, whilst you're here for $5.99, you can buy this, 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 and this. And petrol are always there, aren't they? Those fleecy, lightweight with paw prints on them. Absolutely 100%. I'm really aware of the time because we've already coming up to an hour. Now, what we could do, Amber, if you were willing, would you come back?
Of course I come back. Of course I'll come back.
So why don't we, because I don't want to rush the next bit, and I have a horrible feeling that we could end up tramping through the next section because we've still got to talk about pain medications, we've still got sleep disorders, etc. And there'd be a terrible tendency to rush through that, which I think would be an absolute terrible. So what we could do is maybe look in the next week or so, see if you've got any availability. I'll make myself available and we'll do part 2. How do you feel about that?
Yeah, I think we can do that. I think because there are some things to talk about with medicines and there are some things to talk about within the gut as well that are quite new in veterinary medicine and in medicine in general, which I think, again, it's a bit like the whole sleep thing. It doesn't matter whether you've got an arthritic dog right now or not, there's going to be some useful take home points about those things, and we can rush over them in terms of the painful dog, but actually there's more that we can kind of dig out of that to be relevant, I think.
Definitely.
So absolutely.
And we have so many people that, and it's lovely, and carry on doing this, guys. If you find Cam helpful, I get a lot of pleasure out of getting nice emails. So, you know, Hannah at arthritis.co.uk keeps me quite happy, but we get these beautiful emails saying what I learned in the latter half of my sadly past dog's life has made a massive impact on my new or my other posse of dogs, their lives. So if we can get you back and we can keep this wide rather than just being so narrow only about pain, that'd be amazing.
Good.
Cool. So what we'll do is we're going to say goodbye now just because of timing. I also got told the other day, we had a digital review, and I was advised that these Facebook Lives are a bit too long and people get burnt out and their brains switch off. So I'll start trying to keep them about 45 minutes. We're going to go. I will let you guys know when I can get Amber back and we'll go straight into part 2. All right? Anyway.
Yeah, and if in the meantime they want to dot some questions down, you know, on my page or your page, I have a business page called Understand Animals, where you'll find me on Facebook, and I had a post on there today saying about tonight, so you can leave some comments there, or you know,
and just
obviously
put your comments down here.
Feed,
exactly,
and then we can bear them in mind for part 2 and come back to a few elements of these if there's further things to discuss, for sure. Can't we?
No, definitely. And before
great.
Amber was saying to me that she really feels that her mission is to educate. So I'm just going to take advantage of that, basically. We're going to just mentally pull it all out of your brain while we can. So cool. Right. Until then, we will see you later, guys. Take care.
Thank you, everybody. Thanks, Hannah.